Dr. Danielle Carr, assistant professor at the Institute for Society and Genetics at UCLA, who wrote an essay in the New York Times, Mental Health is Political. Danielle, thanks so much for being here. Really appreciate it.
Thanks for having me.
Of course. So, mental health is political. Now, you asked the question in the piece, are we really in a mental health crisis? And for a lot of people, they'd be like, of course, right? My mental health is suffering right now. But you use the term medicalization of mental health. There is a lack of kind of maybe intersectionality and political understanding of mental health in this country that leaves a ton of gaps in our understanding. Just talk a bit about the biggest picture part of your idea about this, and then we can zoom in more on some specifics.
Yeah, definitely. So I think the underlying or overarching point of the piece is that a crisis that affects mental health is not the same thing exactly as a crisis of mental health. And what I mean by that is certainly not the position that mental illness is fake, or even that mental illness is non-biological, but that when we are thinking about what kind of a problem it is and what forms of causality are at work here, there's a difference between saying everyone just weirdly happens to have the same biomedical disease on an individual level, and saying that there are structural systems in place that are producing these biological conditions that correspond to deteriorating mental health states.
Right. And so it's for me, it's reflective of an atomization of our healthcare system that we're, especially in the United States, designed to treat our healthcare on an individual basis. It's also a function of capitalism as well, where our healthcare is costly, sometimes is stress-inducing, and when you're dealing with healthcare around stress, it's a bit of a cycle.
Yeah, I mean, I think definitely that you see this in all kinds of ways. Medicalization, of course, does not only happen with mental illness, but you see this in like a million different ways, where there's a sort of rhetorical trick that happens where the problem is reduced to the level of a single individual's biology. And that's a much easier problem and a more profitable problem to fix than looking systemically. So for instance, I think diabetes, specifically type 2 diabetes, is a great example where, everyone thinks that we should reduce the rate of diabetes in this country. And of course, the reason why the rate of diabetes is so high in the US as compared to, comparable like Western Europe or whatever, is that there are infrastructural changes that would have to be made in order to address population levels of diabetes, right? And so I think that there's also something going on here, though, with the for-profit model of medical care as it operates in this country. I mean, capitalism is, and profit generation is baked into not just what gets framed as a medical problem, but the medical system itself. And so, this makes a difference when we're talking about proposed cures. If we are having a mental health crisis in the way that it's often being discussed, then the solutions will look like, for instance, the booming market in telepsychiatry. If you think about like BetterHelp, Cerebral, Done, the sort of, we're all kind of getting these ads on our Instagram and TikTok and whatever that are trying to sell us on the idea that yet another round of profit generation through these startups that are doing things like slinging medications, psychoactive medications, addictive medications, with very little accountability into what is, and what I argue is, a social crisis that is having medical effects.
So can you talk about can you expand on the better help and kind of explosion of these kinds of apps and quick fixes for mental health that is, I would imagine, quite profitable for some of these startups. But does this have the same level of oversight that, say, traditional doctor-patient relationships have? Like, how have they been able to exploit this as a marketplace? Because it seems quite dicey.
Well, I'm glad to have the chance to talk about this because I think a lot of people don't realize that this is happening. There was some coverage of Cerebral specifically by the Wall Street Journal, and I want to say there was an investigative report by Bloomberg, but it didn't get as much of a press cycle as I thought that it would. And of course, Cerebral is not the only company doing this. They were just the most egregious. So one of the things that happened during COVID, of course, there had already been telepsychiatry, but the kind of sea change in the market had not yet happened. During COVID, the rule mandating that you have to see your provider in person at least once in order to get the prescription for Schedule 2 medication. So we're talking Adderall, we're talking a bunch of controlled substances, right? That rule was lifted for obvious reasons. But this is why there was suddenly this kind of, we were all getting ads that were like, do you want Adderall? You can basically have some. Right, like on Instagram, and of course, these are extremely profitable. These are also, it's like not totally clear what forms of data these apps are collecting on us. So, for instance, BetterHelp is currently, there's a class action lawsuit against BetterHelp because the very poor privacy protections that were in place for what is, an important medical encounter, and so. There's a movement right now, as you can imagine, from these companies to lobby, for instance, to keep the rules that were instated for COVID in place because a great deal of the profit model depends on those loopholes. I think people should think very seriously about that. But so that's wrong, right? We know that's wrong. But in another sense, and maybe in a more global sense, and this is not to indict any of the very hardworking and well-meaning and often heroic medical providers who are working on these platforms, albeit in an increasingly kind of gig economy model, which results in degradations in quality of care. This is not to indict them at all, but just to say, it's not totally clear that this is the type of thing that is going to really make a serious difference with population levels of mental and emotional distress.
And, what you brought up the pandemic, it really is striking how in the United States, this is a bit of a tangent, but our level of vaccine hesitancy was so much stronger than other countries that have a track record of providing socialized medicine and subsidized medicine from their government, where preventative care is encouraged because it's not, going to cost you $1,000 if you're going to go see your doctor, or $5,000. There is much more of a holistic, and I don't use that in like the lavender oil sense, but much more of a holistic understanding of one's healthcare because of the profit motive for at least much of the profit motive being stripped out from underneath that. And that could apply to the way that the US relates to mental health care as well, potentially.
Yeah, I mean, that's actually a good point. I haven't heard made anywhere else that in connection to vaccine hesitancy. I think that's very plausible and smart as a take. I think also, though, one of the things I'd like to encourage people to think about is, so it's not that I'm saying that we live in a society and therefore, if we just like ended capitalism, that everyone's mental health would be better, right? This is kind of pie in the sky, too idealistic to really be useful for people who are, experiencing very real suffering right now. But if we want to be serious about solutions and thinking about concrete possible solutions, we need to reframe the problem such that the solutions that occur to us are different solutions. So, if you think about the amount, Biden's mental health care plan proposes to establish a series of like hundreds of behavioral health clinics. And, it's not that I think that that's a bad idea. And it's not that I want to say there's some sort of scarce amount of government money that should go to this or that. But we also have to think like, okay, what about housing support? What about public transportation? What about things like, addressing food insecurity for people? These are very real problems that impact mental health, right? And And so what I am suggesting is that just because a problem manifests in the body does not mean that the solution to it needs to be medical care, much less medical care that is transacted through this highly individualistic, extremely for-profit way that American medicine works.
Yes, and that brings us right back to the thrust of your piece, which is something I couldn't agree with more, which is targeting the source of some of the generalized stress and thus anxiety that it has kind of ballooned in society, which is one that is created from insecurity of food, poverty, discrimination, capitalism more broadly, and then especially in the unfettered neoliberal model that our government has adopted. And I mean, just can you talk a bit about how alleviating those stressors of housing and those kinds of things and making people just actually able to live a comfortable life, especially when we're the wealthiest country on earth, could be perhaps the most efficient way to actually target mental health without atomizing it, in particular by atomizing ourselves and thus medicalizing it and making it distinctly medical.
Yeah, so I think this is a good time to reiterate that my position is not one of the anti-psychiatry movement that you may remember hearing about from like the 1970s with like Thomas Zaz, R.D. Laing, even Foucault to a certain extent, that held in some portions of the movement held that mental illness was completely fake, essentially. It was completely constructed, that there was no biological reality to these diseases. That's not what I'm saying. But when we talk about what kind of a disease is a mental illness, mental illnesses are categorized using a system called the Diagnostic and Statistical Manual. And the Diagnostic and Statistical Manual, or DSM, became prevalent with its third publication in 1980. And what you need to know about this is that there was a big fight going on between people who had a sort of psychoanalytic or a psychodynamic orientation, so like, you know, the therapists, and the psychiatrists who are trained as medical doctors. And the medical doctors, of course, want to reduce everything down to like, this is the biological illness in the same way that breaking your leg is a biological illness, and we're going to find the causality that works through like neurotransmitters, right? And the psychodynamic people were not so hot on that idea. So what emerged from this power struggle was an agreement that, well, we're not going to really posit causality in these diseases. What we will say is that these symptoms tend to cluster together. And we're going to say, like, because these symptoms of, for instance, like depression, so like weight gain or loss, sleep loss, feelings of fatigue, feelings of hopelessness, whatever, we're going to just say that that's a disease. But there's actually no guarantee that at a neurobiological level, or at a if you put someone in a scanner, or if you like take their blood or whatever, that there's a biological basis for the entity of depression. Now, I'm not saying that there's not, to this extent, that any mental state corresponds to some sort of biological state. Of course, there's a correspondence, but we're not talking about the same kind of thing as tuberculosis, where there's a well understood pathophysiology. In fact, if you talk to any leading neuroscientists in the field, they will tell you at a neurobiological level, at the level of having figured out the biological basis for something, depression is not a meaningful concept. And same goes for anxiety. I mean, I'm talking about those two because those are the two most commonly diagnosed ones. And so when we're thinking about like, what is the biology of these disease entities? Well, these are not disease entities in the same way. And so, the idea that you can just take a drug, or that there's some sort of well understood medical intervention that is going to just address this because it's a disease in the same way that tuberculosis or typhoid is a disease, this is just not scientifically true.
And it's a tricky kind of tightrope to walk, because you don't want to speak to somebody and say, well, your depression is societally caused in particular, or it's not a disease for you, because it is. It's just, in the same way that maybe that frankly poverty increases the likelihood of other diseases. In the same way that you know, living in an area near a plant that is giving off some sort emitting fumes that are toxic might increase the likelihood of some kind of disease, right? You can I think that there's a bit of a in the same way we've spoken about this on this program, where like economics should be seen as one of the branches of understanding society, much like sociology. You see them as a whole, but economists kind of feel that like they're scientists and their view is exactly the way things are. Um, per, Putting mental health in and medicalizing it, and thus cutting it off from all of the other intersectional just realities of what goes into mental health, it's almost in the it's kind of in the same vein, right? Where this is scientific and unchallengeable, and then there's no real end to in sight, because you're not effectively combating any of the underlying problems.
Yeah, I think that the toxicity metaphor is a really good one, or analogy there, because, like, if you think about, like, if there's a nuclear waste dump near your house, and then you see, of course, in your community, you're going to see elevated levels of cancer, right? It's not saying, it's certainly not accurate to say that cancer is not a biological problem. But if all that you do is treat the cancer without addressing the toxic waste dump, you're going to continue having cases of cancer. Now, the analogy breaks down there, because our treatments for cancer that are available currently, given this sort of state of the art of medical care, are much more effective than the treatments that we have for mental illness. It is a fact that if you look at an aggregate at clinical trial data and what are called meta-analyses, or basically analyzing many, many studies at once, treatments like SSRIs for depression tend to not operate very much better than placebo. That's not to say that they don't help some people, and it's not to say that they don't address a sort of biological reality for many people. But the reason for this is that we're lumping too many things together under the same name.
Right. Like SSRIs work for people that it work for, but but when when the umbrella is way too large, then how do you even know where the effectiveness lies, right?
Yeah, exactly. And I think the other thing to be said here is that I'm also making a scientific argument here that's well supported by a great deal of the literature, which is that chronic stress has real biological effects. So, for instance, chronic stress of the sort that you experience as a person of color, as a person who doesn't have very much money, right? As someone who's like, so like we live in a society, right? Has chronic, so chronic stress elevates different chemicals in the body, different hormones that have downstream effects that influence the sort of the way that different parts of your brain talk to each other, and the way that your body operates. And so I don't want to bore your viewers, but I would
No,
really
it's not boring. Please.
Instance,
You have no idea how dry we get on here. Please.
okay. So, for instance, Robert Sapolsky has a great book called Why Zebras Don't Get Ulcers that kind of gives you a walkthrough of the connection between what's called the HPA axis, the hypothalamic pituitary adrenal axis, and different mental conditions. And this is happening at a biological level. So again, I think it's a false binary to say either mental illnesses are completely biological disease entities in the same way as tuberculosis, or they're completely caused by society and there's no biological reality. Well, there's a needle to be threaded here, right? Which is that society produces biological conditions. And I think for too long, you risked cancellation by people, who very rightly were up in arms about the stigmatization of mental illness. But it's not saying that it's the individual's fault to say that it's not a biological disease entity in the same sense as typhoid. I think there's a third way to be staked out here, and that's what I'm trying to do.
It's funny you mentioned why zebras don't get ulcers, because my best friend is a psychologist and she has been recommending that book to me for a really really long time. So now it's gonna force me to have to read it now. But I guess that kind of brings us to the biggest picture element of it, which is just how actually solve the mental health crisis. And I think on this show we've spoken a lot about how moving towards a society where that is closer to a democratic socialist country, as where housing is guaranteed and where wages are increased and where healthcare is provided. That is the way forward. But for your prescribed solutions, is that what you see as something that probably is that for lack of a better phrase, that's the prescription that is really necessary here?
Yeah, I mean, I think that it has been, if I'm going to be very honest, it's been very funny to me to have published this piece and to, hear all of the feedback from everyone. And most of the feedback, if you look, at the comments on the Times piece, or, my inbox was overflowing with psychiatrists who are like, this is very obvious. And people who work in the field will tell you that this is very obvious. And I think that it's certainly indicative of the state of affairs that publishing something that is completely obvious in the New York Times is remarkable.
Yeah, I mean, especially in the opinion section, we just we need it, which is populated by Brett Stevens. This was a welcome change.
Yeah, exactly. It was just it's compared to what,
You're like, what the hell is this, right? In comparison, no one knows what to do with it. But anyway, really can't appreciate your time enough here. Thanks so much for coming on, Dr. Danielle Carr, assistant professor at the Institute for Society and Genetics at UCLA. And you can read her essay in the New York Times, Mental Health is Political, as a part of their broader series on this topic. Thank you so much for your time today, Danielle. Really appreciate the discussion.
Thanks so much.
And
this
enjoyed
was really
it.
Fun.
Yes, for sure.
Complete mental sort of breakdown.